Hello, everyone. Welcome to another exciting episode where we break down all the tips, tricks, and strategies to help you conquer the OET writing section. This is the place to be if you want to nail that referral, discharge, or clinical letter with ease. I'm not here just to give you some boring, dry information. We are going to dive deep, break things down, and I will show you how to make these tasks your secret weapon to a top score. Let's start with one of the most important things in writing your OET letter: structure. Think about it like building a house. You need a solid foundation, walls, and a roof to make it very strong. Similarly, your letter needs a clear, logical structure to stand tall. Imagine you're a doctor and you have a patient named Sarah who has just been diagnosed with high blood pressure. So you need to refer her to a cardiologist. Here's the structure you should follow. Start by addressing the right person in professional way. Example, dear Dr. Smith. And then introduce the patient and the reason for your letter, the purpose, right? So try to be very concise but clear. Here is an example. I'm writing to refer Ms. Sarah Thompson, a 45-year-old female patient, for further evaluation and management of her newly diagnosed hypertension. Then the body. So now this is the part where you shine. Try to provide all the necessary details like the symptoms, test results, history, and medications. Example: Ms. Thompson presented with complaints of occasional headaches and dizziness over the past 2 weeks. Her blood pressure today was 160 by 100 mmHg. Her medical history includes obesity and a family history of cardiovascular disease. She has been prescribed lisinopril 10 mg daily. And try to request for action. Ask what you need from the recipient. Here is an example when you're requesting for action for the same content. I would appreciate your assessment and any recommendations for her ongoing treatment, including lifestyle interventions and possible adjustments of her medication. And try to close it, wrap it very nicely. Thank the person for their time. Okay, so thank you for your attention to this referral. Please do not hesitate to contact me should you require further information. And sign off like, kind regards or best regards, Dr. John Doe GB. See how easy it is to follow a clear structure. Here you have introduced the patient, given the details, made a request, and signed off politely. This is the best way to ensure your letter is logical, professional, and easy to follow. Think of it like telling a story where you guide the reader through the essential details step by step. Now, the second important thing is adding depth to your letters, use of medical vocabulary. This is something that you can make your letter stand out, medical vocabulary, right? Because this is your chance to show you know what you're talking about, but don't go overboard. Remember, accuracy and clarity are key. Imagine you are writing a discharge letter for a patient who has been hospitalized for pneumonia. So instead of using very simple terms, spice things up, little advanced vocabulary, but in a way that's still understandable. Here is a basic example. The patient was treated with antibiotics and is feeling better. They need to follow up in 2 weeks. Now let's see an enhanced example. Miss Linda Miller, a 60-year-old female, was diagnosed with community-acquired pneumonia and was treated with intravenous antibiotics for 5 days. Her condition has improved significantly and she is now stable enough for discharge. She is advised to complete a 10-day course of oral antibiotics and written for a follow-up consultation in 2 weeks to assess her recovery. Got it? So here it sounds much more professional and very detailed. Word like community acquired, intravenous antibiotics, and follow-up consultation. It make the letter sound more informed and trustworthy. So this is the kind of language you need to use in your OET writing. It shows you can effectively communicate medical details with precision. Now, very important thing, it's like one of the biggest killers of an any OET letter is ambiguity. No one likes unclear writing, especially healthcare professionals who are reading your letter. Example scenario like if you are writing a referral letter for a patient with severe back pain. Here's what you don't want to write. Remember, this is how you should not write. The patient has been having back pain for some time and was given some treatment. Please see the patient soon. Confusing, right? It's very unclear what kind of treatment was given, what sometime means, and what soon means. You have to be very specific when you're writing. Now, let's fix that and make it very clear. Let me give you a clear example how you need to write it. Mr. David Grant, a 35-year-old male, presented with acute lower back pain which has persisted for the past 2 weeks. He was treated with a course of non-steroidal anti-inflammatory drugs, but his symptoms have not improved significantly. I'm referring him to you for further evaluation and potential imaging studies to rule out any underlying spinal pathology. An appointment within the next week would be greatly appreciated. Notice how the second example clearly outlines the duration of the pain. Here we are mentioning it's 2 weeks and the treatment given NSAIDs, right? And the next steps referring for further evaluation. So specificity makes your letter not only clearer but also more actionable. Okay, and the next one is your tone and formality, keeping it very professional, because in healthcare it's essential to maintain a professional tone in all communication, even when you're writing a referral letter. Tone means the way you express yourself, and the formality refers to how polite and respectful your language is. Let's say you're writing a letter to your colleague about a non-urgent issue. Here is an informal tone. Hey, Dr. Sarah, I'm sending you this patient's details for a follow up. Could you see them sometime soon? Not ideal, right? We are dealing with professional healthcare, so we need a polite and formal tone. Now I will show how you could rephrase it in a better way. Dear Dr. Sarah, I'm writing to refer Ms. Angela Williams for a follow up consultation regarding her ongoing treatment for type 2 diabetes. I would greatly appreciate it if you could see her at your earliest convenience. Please do let me know if you need any further information. In this example, we are still being friendly, but we are respectful, polite, and professional. Remember, the tone is just as important as the information because it helps you sound competent and trustworthy. Try to keep your audience in mind and match the level of formality to that situation. Fine? All right, future OET writers, now that you have a good understanding of how to structure your letter, use precise vocabulary, how to maintain clarity, and keep the tone professional, you are well on your way to acing your writing task. And remember, practice makes perfect. So keep refining these skills and applying them to different scenarios. I want you to try this now. Think of a healthcare related situation, whether it could be a referral, discharge, or a clinical case, and write a short letter. Be sure to follow the tips we have covered today. Okay, that's all for today's session. See you in the next video. Bye for now.